Hi everyone, good morning, good afternoon, and good evening to all of us. So today I'm going to share you about my report, Motor Disorder. Before that, I'd like to present an overview of motor disorders. Our discussions will cover the following key points. The first one, of course, the definition, followed by the causes, life skills, resources, and lastly, what do we need to know? So let's start. Motor disorder. Motor disorder is a condition that affects movement and muscle control. It's a neurological disorder that affects motor skills development and function. Motor disorders can make everyday tasks difficult. Anyone can have a motor disorder regardless of age. Motor disorders can range from mild to severe. So it says there that motor disorders are a group of conditions that affects an individual's ability to control and coordinate their muscles, movements, and motor skills. These conditions, which include cerebral palsy, Parkinson's disease, muscular dystrophy, dyspraxia, and dysgraphia, can significantly impact an individual's daily life. At the core of motor disorder is a challenge in regulating and harmonizing muscle movements, which are essential for everyday activities such as walking, writing, and dressing. As a result, individuals with motor disorders may find these tasks more difficult, and the effects of the disorder can vary widely depending on the specific condition and its severity. Therefore, it is crucial to understand and address these conditions in order to provide support and help individuals with motor disorder manage their condition and life fulfilling lives. As part of our ongoing education, I'd like to share a video about motor disorder to raise awareness and understanding. Let's watch this.
Understanding Parkinson's disease. Parkinson's disease is one of the most common degenerative diseases of the nervous system. It is most common in people over 65 years of age and can affect younger people as well. Patients under 40 are classified as young-onset Parkinson's and make 10 to 15% of all cases. In Parkinson's, specific neurons in the brain start to malfunction. They make less of a chemical called dopamine that is involved in generating movement. Scientists do not yet know exactly what leads to the death of these dopamine-producing neurons. In most cases, they believe Parkinson's is due to a combination of genetic changes and environmental factors, with young-onset patients perhaps having a stronger genetic contribution. Parkinson's symptoms can be broadly divided into two types: motor or movement-related, and non-motor symptoms. Non-motor symptoms might show up earlier, but can occur throughout the disease. Non-motor Parkinson's symptoms can include loss of sense of smell, sleep problems, constipation, and depression. Some non-motor Parkinson's symptoms may be associated with Parkinson's medications. These can include daytime sleepiness, hallucinations, or seeing things that aren't really there, drops in blood pressure, and psychosis, or losing touch with reality temporarily. Tell your doctor if you have any of these symptoms. Changing medications may help. Tremor is not always present but can be the most noticeable motor symptom of Parkinson's disease in many cases. The tremor is usually in the hands at rest, but can also be present in the legs or even the chin. The resting tremor of the hands is often described as pill rolling with the thumb and other digits involved. Other motor symptoms include slow movements or bradykinesia, stiffness, reduced facial expression, changes in posture, and trouble with walking and balance. Motor symptoms usually start on one side of the body and can spread to the other as the disease advances. There are a variety of rating scales that Parkinson's specialists sometimes use to track changes over time. Doctors sometimes divide Parkinson's disease into 5 stages. Progression is typically slow, but can vary from patient to patient. In stage 1, Mild symptoms, usually including tremor and other motor symptoms, affect one side of the body and produce little disability overall. In stage 2, symptoms make daily activities more difficult. Movement problems are on both sides of the body. Posture and walking can be affected, and disability is mild. In stage 3, movements are moderately slower, balance is more affected, which puts patients at greater risk of falling. Dressing, bathing, and doing other daily activities have become significantly more difficult. In stage 4, significant mobility issues require the use of a walker to move around. Patients need considerable help doing daily activities and are unable to live independently. In stage 5, balance and movement problems are severe enough that the person needs a wheelchair and nursing care. They may also have noticeable mental changes, delusions, or hallucinations. Learning about the stages of Parkinson's can be frightening. However, not everyone with Parkinson's will progress to stage 4 or 5. It's important to remember that Parkinson's affects everyone differently, and you may or may not have all the possible symptoms. Doctors treat Parkinson's disease with medications to relieve symptoms. Starting these medications does not slow the progression, but can provide benefit to patients that improve and maintain their quality of life for many years. Advanced therapies such as surgical implantation of a deep brain stimulator may also help in select cases as well. If you suspect Parkinson's, a careful examination by a specialist in Parkinson's disease and other movement disorders is essential. You can search for Parkinson's Centers of Excellence, which are located in most major cities in the U.S. It's also important to learn your treatment options. With today's medications and treatments, the outlook for people with Parkinson's is much better than in the past. You and your doctor can create a personalized treatment plan together.
Now that we've learned about motor disorder, let's think about how we can make a positive impact in our community. For you, how can we support individuals with motor disorder in our daily lives? So, let's work together to create a more inclusive and supportive environment for everyone. Thank you for watching this video with me. I hope it was informative and thought-provoking. If you have any questions or would like to learn more, please don't hesitate to ask. Now, let's move on to our next topic, the causes of motor disorder. So, motor disorder can be caused by genetic problems such as muscular dystrophy. This means that some people may be born with a genetic condition that affect their motor skills. For environmental factors can also contribute to motor disorders. These include the exposure of toxins or infections before birth. If a pregnant person is exposed to toxins or infections, it can affect the developing fetus's motor skills. The second one is injuries during birth. Injuries during birth, such as lack of oxygen or physical trauma, can also affect motor skills. The third one is head injuries. Head injuries such as consciousness or traumatic brain injuries can damage the brain and lead to motor disorder. For neurological factors, neurological issues can increase the risk of motor disorders. These include brain damage, damage to the brain such as from a stroke or infection can affect motor skills. Next one is the diseases like Parkinson's and Alzheimer's. These diseases can damage the brain and lead to motor disorders. The next one is autism and ADHD. These developmental disorders can also affect motor skills. Other factors in addition to genetic, environmental, and neurological factors other can contribute to motor disorders including infections such as meningitis or encephalitis can damage the brain and lead to motor disorders. Toxins, exposure to toxins such as lead or mercury can also affect motor skills. lack of nutrients. A lack of essential nutrients such as vitamin D or iron can contribute to motor disorders. To understand the cause of a motor disorder, a healthcare professional must be a thorough diagnosis. Okay, now we're done discussing the causes of motor skill. We will now proceed to the life skills of motor disorder. People with motor disorders may have trouble with daily living skills. Dressing and grooming, they may struggle with buttons, zippers, or utensils. Feeding, eating, drinking, or swallowing can be hard due to coordination issues. Bathing and hygiene, they may have trouble bathing, using the toilet, or keeping clean. Mobility and transportation, they may struggle for walking and balance. They may struggle with walking, balance, or coordination. Using stairs, they may also struggle. Navigating stairs can be hard due to muscle weakness. Driving or using public transportation, they may have trouble driving or using public transportation. For communication and social skills, speech and language, they may struggle with speaking clearly or understanding language. Social interactions, they may have trouble starting or keeping conversations. For emotional regulation, they may struggle with managing their emotions. Cognitive and academic skills, learning and memory, they may have trouble learning new things or remembering tasks. Problem solving and planning, they may struggle with planning or solving problems. For academic performance, they may have trouble with schoolwork, writing, or using technology. For recreational activities, participating in sports or games, they may struggle with physical activities. For engaging in hobbies, they may have trouble pursuing hobbies or interests. Maintaining social connections, they may struggle with keeping friendships. These challenges can vary depending on the individual's motor disorder and how severe it is. So we will now move on to the next topic, which is the resources of motor skills. A person who has motor disorder needs to be accommodated with special education programs or services that are specifically tailored to address their motor skills difficulties. These are the therapy, like physical education, and special therapy can help. Assistive technology like wheelchairs and communication devices can make life easier. And lastly, support groups and online communities can provide emotional support. These resources can provide individuals with motor disorders with the support and services they need to develop their motor skills, participate in activities, and live independently. So this is my last topic. I will be sharing to you on what we need to know about the topic motor disorder. It says there that there is a treatment, so these are the physical therapy. This can improve muscle strength, flexibility, and range of motion. Occupational therapy, improving daily skills and independence. Speech therapy, this can improve communication and swallowing skills. Medication, managing symptoms like muscle pain and seizures. Surgery, relieving pressure on nerves or repairing damaged muscles or tendons. We can create a more supportive environment for people with motor disorders by raising awareness, educating others, and advocating for their needs. That's all for today. Thank you for discussing motor disorders with me, and God bless.